mynews.studio.
Imagine a disease that once put 1.5 billion people at risk of blindness. Today, for the first time, fewer than 100 million face that threat. Is it really possible that we could eradicate trachoma by 2030?
Today's date is February 17th, 2026. Let's set the scene. In 2002, 1.5 billion people were at risk of trachoma. Fast forward to late 2025, and that number has dropped by 94%, down to 97.1 million. What happened in those 20 years to make such a difference?
The main reason is what's called the SAFE strategy. That stands for surgery for the severe cases, antibiotics like azithromycin, facial cleanliness, and environmental improvements, especially sanitation and water. It's a straightforward approach, but it made a huge difference. But why did this combination succeed when earlier efforts didn't?
A big part of it was moving from scattered, local responses to a global, coordinated push. The real shift began with the WHO Alliance in 1996 and the International Coalition for Trachoma Control. But there was still a major blind spot: data. That started to change with the Global Trachoma Mapping Project in 2012. How did having better data change things?
The mapping project relied on smartphones to survey 2.6 million people in 29 countries. For the first time, ministries had a clear picture of where trachoma was most severe. That meant they could target antibiotics, surgeries, and hygiene campaigns where they were needed instead of making rough guesses.
So, do you think that's why we saw progress accelerate so quickly after that?
Exactly. And after that, the Tropical Data Initiative followed up. Over 4,000 surveys in 55 countries, reaching 13.1 million people. This evidence-based approach led to major interventions. Just as an example, Ethiopia, still the most affected country, delivered 22 million antibiotic doses and performs 98,000 surgeries in 2023 alone.
Ethiopia's case really stands out. It still has about 59% of the global burden. That's around 61 million people at risk. But with those targeted campaigns, 22 million people got treatment and 98,000 advanced cases were managed in just a year. That's significant impact. But it's important to point out providing this level of care wasn't simple or cheap. Pfizer donated more than 1.1 billion doses of azithromycin through the International Trachoma Initiative.
In 2023, there were 130,746 surgeries, almost 71% were for women, and antibiotics reached 33.9 million people across 19 countries. But it's more than just statistics. The World Health Organization has now validated 27 countries as trachoma-free, including places like Egypt and Fiji. 10 more have eliminated it, but are waiting for formal validation.
It signals what's possible when there's coordination. Take the Americas. PAHO is implementing the SAFE approach in places like Brazil, Colombia, and Guatemala, training surgeons and improving water access. This fits with Sustainable Development Goal 3.3 and the WHO's 2021 to 2030 roadmap for elimination. But I wonder, could this strategy work for other neglected diseases?
That's an important point. The Mass Drug Administration, community-level training, and using data platforms, these are approaches that can be adapted. Some programs are already trying this, especially in areas where poverty and infrastructure are challenges. But there are hurdles, like the $300 million funding gap for surgeries, medication, and ongoing surveys.
And there are other obstacles. Reaching people in remote areas, conflict zones, even supply shortages for antibiotics. There's also a gender gap. Women are almost twice as likely to need the painful TT surgery, yet they're more likely to turn down treatment.
It's partly social and cultural. Women have more exposure because of childcare responsibilities, but may face stigma or practical barriers to getting surgery. Some programs are starting to adapt. They're collecting sex disaggregated data, which the WHO now requires, and focusing on community outreach. Local NGOs are even training female health workers so patients feel more comfortable. Mobile clinics are also reaching remote areas, especially in Ethiopia and across the Americas.
It's a good reminder that even with big progress, we can't overlook equity. Who gets treatment and who doesn't still matters. But overall, this shows that coordinated international action can actually end ancient diseases.
So, when we look ahead to 2030, the question isn't just whether trachoma will be gone. It's what else we might achieve using this same approach for other health challenges.
That's a story we'll keep watching. Thanks for joining us as we explored how a global partnership is close to ending infectious blindness.
We broke down the SAFE strategy, the impact of better mapping and data, the importance of coordination, and why solving equity issues is key to finishing the job.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.